Well, the Alzheimer's Association is out with its annual report that puts the disease and its numbers under the microscope. For the first time, the report includes a special focus on the dementia workforce, and it uncovered an alarming trend in Indiana. Business of Health reporter Kylie Valletta has more. Kylie.
Some 110,000 Hoosiers are living with Alzheimer's, and the prevalence of the disease grows each year. But the report highlighted just how wide and deep the gap is in care for these people. The report showed there are currently only 66 geriatricians in the state. That's less than one geriatrician per county. Indiana will need a more than 300% increase to close the gap in these specialists in the coming years. Joining me now to tell us more about what the report uncovered is Laura Forbes, Communications Director at the Alzheimer's Association Greater Indiana Chapter. Thanks for being on the show today.
Thank you for having me.
Well, we talked about the geriatrician shortage in the introduction, but that's just one specialty. So tell us about the shortages that were found in this report in other parts of the workforce.
Yeah, one other area is with home health aides. We're going to need a more than 37% increase by the year 2028. So not very far away, and more Hoosiers, more Americans are choosing home health aides to help with their care when they have dementia. So that is a great need as well.
Right, and like you said, 2028 is not far away at all. It also uncovered this really interesting contrast between Hoosiers who are living in the rural part of the state and those who are living in cities. Explain that.
Yeah, so unfortunately there are a number of health disparities when it comes to dementia care, and this is one of them. So the report found that most physicians, overall primary care physicians, say that they don't have enough specialists in their area, but it was much more pronounced in those rural communities and small towns as compared to large cities and suburbs.
And you mentioned home health aides. Another first in Indiana is there was a bill passed. The governor signed it just days ago, focused on home health aides. Tell us what this bill is and the significance of it.
Yeah, this was a big victory for us and for families facing dementia. So for the first time, this bill, this law, establishes dementia training standards for home health aides. So we're really hopeful that this will help improve care for those patients first and foremost, but also we know that having that dementia training really helps to reduce burnout in those industries as well. So it's really a win-win.
So the presence of Alzheimer's grows each year. This is an annual report. The need for care grows each year. There's no cure. So it feels like a hopeless situation. So what is the silver lining?
Absolutely. So the report did find some good news in that area, and it found that most Americans and most physicians are really hopeful when it comes to future treatments for Alzheimer's and other forms of dementia, and there's really good reason for that. So last year we had the first drug approved that treats the disease itself and not just the symptoms. So that was a huge milestone, and there are more than 100 other disease-modifying treatments that are in various stages of clinical trials and in the approval process. So we have a lot of reason to be hopeful when it comes to that. And in the meantime, you know, the Alzheimer's Association is here to help people who are facing the disease, and we have services available 24/7, completely free of charge. So that's the other piece of good news.
And I know the IU School of Medicine is certainly leading the charge in some of those Alzheimer's progress and treatments.
Yes.
Just a little bit of time left, but we hear about healthcare burnout. Home health aides already have a high turnover rate. There's the Great Resignation going on. All of these challenges in the market. How do you surmount that and still grow the workforce?
Yeah, so it's going to take a number of approaches. Certainly more public policy. So we'll continue to push for public policy changes that will help address some of those issues. And we also need to think about how, you know, in the absence of some of these specialists, we can help ensure that primary care physicians are prepared to discuss the signs and symptoms with their patients, perform cognitive tests, and make those diagnoses as well. So it's sort of a multi-pronged approach.
All right, Laura, well, thank you for sharing the report with us, and thanks for being on the show today.
Thank you again for having me.